Okay, so Sam, let me see. Let me check this again. Okay, yes. So we are recording. So Sam, you can go ahead and start.
So you can see my screen, everybody. Yes?
Yes.
Very good, very good. Several items for you. Number one, 1 minute, 1 hour and 37 seconds, part one is now at AIA Orange County. The best way to find it once you go to the site, go ahead, do the filtration. It was done about a day ago. I would not do, when you go to there, don't do today. Put down 1 week, you'll get that and you'll see the write-ups, the work that we have done right here. And then the other item is, this is my website, and this website is there. This is my blog, and actually if you just type Psalm's blog, you get there. It goes forever. This, I've been typing on this thing for about 10-15 years. This was the lecture that I give to ASHRAE. It was a mechanically tuned lecture. And if you go further down, you will see all my books and my writings. This is a purely all my podcast for the plumbing code changes, and being licensed in electrical, mechanical, structural, I have them all. So I go over just about everything. And here is the 2018 version of the AIA that I did. I had a problem with my WordPress. Now I'm going to be backlogging a lot of these there, and goes on and on. And if you want to pick any of these up right here, for example, this was the USC ARE for programming analysis. You pick that up. There is this 4-part books that I've written is there, and you go on and on. There's another plumbing book that I did. And if you go old entries, it goes forever, pages and pages and pages, so on and so forth. So that's one part. I am going to be putting this particular lecture that you're putting in at some point. I will put it in my blog, but I have to legally clean it up because it has a lot of items that I got to clean up, so nobody can come back and sue me. But if anybody wants it faster than then, I would highly recommend for you all to email me, and I will send you the PDF. I'll be more than glad to send it to you with one promise, that you will criticize it and write memos back to me, et cetera, et cetera. One other part that happened was I did not know how to save the chat that we had. So Bill Calvert, who's a dear friend, as well as I work for him in a couple of buildings. His comment, I did not have it, and I did not have time to go back to him. So when I get the stuff to it, I will pack with the items into this part, and we go from there. I actually spoke 56 pages last time. I had 134, and since past 2 days, I have added another 70 pages. By the way, with having one hand, I do not get COVID-19. I get COVID 9.5 because I wash only half of the germ out. So, but anyway, that's a bad ADA joke. I am in nuclear, so because of that, I've learned risk analysis, and we learned how to be a chicken. These are still my licenses, not electrical college of anybody. I always begin with this, and this time I put a different face of this. And this was, again, I always go to Johns Hopkins. I used to go to another one, was called worldodometer.info. It's no longer there. Again, we are at 44 million in the world, 209,000 tested. And in terms of the globally, 1 million people have died, and global cases, I forgot this one, the number of deaths, etc. 15 million was the American cases, and we go from there. Let me just move on. Last time I was raised in Oklahoma. I had a small little section of Oklahoma put in. This time I put California. And the reason you see the number of deaths, these are per 100,000. Of course, what happens is that this is divided by the population. It's more, but again, is darker only because the population is less. But it's not doing good. Let me just put it that way. I made one error. I spoke too early about ASHRAE. ASHRAE actually does have a does have a task force called Epidemic. They have not written papers that simply said this is the guideline. It's simply there, and everybody refers to CDC. Most of the videos that I watched were professors from different parts of the world, and God bless them. There was one guy in Ireland who's done a lot of work, and two guys from India that I've seen. But in any case, they do have a task force that is doing. They have not put a position paper that could go lead into what we call a code bodies, but these are the different task groups that they have in place. There was a legal question that was asked in one of the chat rooms that I remembered. Again, I did not photocopy it. Again, if you go to every one of the code sections, BOMA, which is on the building owners, management, etc., or you see the AIA or CDC, et cetera, they simply say, hey, go to your risk assessment manager and go to your legal counsel. These are all the CYA issues only because you have to do something. And if you remember the Y2K hoopla, which nothing happened, but everybody had a little section on their contract, I highly suggest that should be still doing the same thing. But again, I have a basic English. Again, I do about two to three cases a year. I simply say utilize your AIA contracts. They were well written. I'm sure they had a little subsection for Ebola and other components. Use my component, which is prudent avoidance, as your BMP. Put it down, and this is what you know as of today, 12/10/2020 at 4:41, and you're designing based on that. So if next week something comes up, you're going to modify, but if it goes out to construction, you will have to do it then. You cannot be sued. So you just have to put all that CYA in bed. There was one question that Brian Jeanette had with temperature. I had to look for it. It was very interesting. And he was dealing with the temperature within a body of a furnace versus a cold. Really at those temperatures really this virus doesn't do anything. But there was a study that I saw that if the sun is acting on a surface which has a SARS-CoV-2, and then 90% of it in 200 minutes will be gone. And then the rest of it in 4.5, I don't know why they didn't go up to that point, but 200. And then the other one was that if it is on a steel surface, the temperature of that on a sun beating on it in 7 minutes, 90% are gone. And that was a question I thought that would be good. I am actually doing this. It's not a court case. It's actually a bad engineering case. I'm actually doing it. You can see I've actually done testing September 20th. This is another issue. I believe Rich Rowell was doing, I don't know if he's present at this time, but he was doing some things, and I wanted to bring up, we discussed the means and the methods of the work, of the items that has to be in the design. The humidity factors, I did not discuss it that much, but I got to tell you that especially if you're using all these Mitsubishis, or I use Samsung, etc. This particular system was a Daikin. This was somebody's bedroom. Look at that. This person is anywhere between 70 to 90% relative humidity. And again, if that was an older person, he would have a very heart issue, and lung issue and breathing issues. And again, you have to watch out if you're using that type of system. And again, what happens with relative humidity? The least life expectancy of coronavirus is at 40 to 60%. By the way, that's the range that all the electronics are made. So if you're too high humid or lower dry, all your electronics, especially when we do data centers, we actually have the humidity right at 50%. God bless the city of Los Angeles. This area is generally about 50%. As you get closer to the ocean, that number gets higher and higher. And again, life expectancy is longer if the relative humidity is less or more. So this is a bad English. Sorry, that was supposed to be modified. Thank you. This is the actual, and the viruses here, fungi are here, bacteria are here. This is the optimum zone. Fortunately, this is where our livelihood is as well. meaning that if it is too dry, you're going to get dehydrated. The water within our system, our eyes will get dry. You have to keep putting droplets. Or if you're in this zone, you're too cold, or at the same time, you're thinking that you're in Bahamas and or Louisiana. I did work in Louisiana. All I can tell you this, that everybody only works from 5 a.m. till 12 noon, and everybody goes home. It is unbearable. So this is the range where the virus is, and the half-life of it is the least at about 60%. That this is the zone. So humidity is a factor. And I just want to give you all, I'm going to write it on my right here. The unit that we actually purchased was by Dwyer. I used it for all my laboratory work. Dwyer is out of Minnesota. And come on, I don't know what happened. Dwyer and is out of Arizona, and it's $154. You don't need anything else. The product is very, very good. You can measure it for 21 days. It's a very good tool to have, just an FYI. My client purchased 4 of them, and we checked it out. There was one other issue that was there. I am, as a lighting guy, as I am always looking for new stuff. Lighting is one of the parts that it shines and makes especially the corridors beautiful, especially the foyer is beautiful. I just talked to a client yesterday, and you want to spend money there. At the same time, I know Kelly sent me, I don't know if she's on this time with us, but she sent me some things. But again, one of the questions that I had for myself was LED and UV lights. Again, GI is the germicidal systems that you have, which is UVC. And again, the answer is yes. You can take the diode and modify it to come out with any nanometers that you wish. The irony was I checked out the price. This actually, I looked it up in Alibaba. It's not that expensive. It's very good. The only thing that I did not check out was the lumens. You have to have a contact time and what's called the energy level. And the last time we spoke, we said, in order to kill a virus, you have to be at 661 microjoules and per centimeter square. So if you apply this, you have to apply all that at the same time. Again, I'm buying these for Alibaba. I buy them, they come in 50 meters roll, which is about 167 feet, or I saw this one particularly at 190 feet as well. So yes, the LED lights could be modified to have at that nanometers. And again, I had a very good discussion today with Niall Saunders, who we do a lot of medical work together. And he's very familiar. Again, the only reason I know UV system, I bought a house with 6,000 gallon koi ponds, and I put all my kois there, and my kois are there, and I have a UV system, but that would be using the mercury lamp, the vapor lamp, which is totally very expensive. The life expectancy is very low, and you have to change that almost every year for about 8 to 10 hours operation. And what it really does, it actually it doesn't actually kill them per se. It actually prevents them from reproduction. In the article that I had previous seminar, in the previous session, it actually kills them, but you have to have what's called a contact time, etc. Unfortunately, many papers, I have not been able to identify what that contact time is. I simply have to look up the machine, take the length of the machine, and assume what the velocity is, and I have to come up with time myself. Anyway, this is on the DNA and RNA for that. But now this is what Kelly sent me. This is a Hubble. We are not making sales here, nothing. All I can say is that what they have done is the following, and I will show you when an air conditioning comes, it actually comes through the ceiling. There's a lot of air in what's called an upper zone. And then there is what's called the people zone, which is the first 6 feet. I'm 5'6". I'm shorter guys and 6 feet guys. So that's called, the ASHRAE calls the people zone and the upper zone. And what happens is that, by the way, UVC is not good for the eye and or the skin. But what happens is that it simply cleans up. That's one more means and methods for you to get rid of the upper disinfection. And this was some of the samples that she sent me. And you can see how it behaves. So you have the lower zone and the upper zone, people zone or the upper zone, and you have the wall sconces. I was doing cellular sites. I did a ton of them when we were doing inside the hospital. And I spunked into this again, and I saw that in a major open corridor. And I asked the guy, he says the Nurses Association asked for it. So these have been around, but is now coming up in the market quite fast, and everybody's coming up to that. Again, don't forget, you have to have the contact and amount of lumens or microjoules on them for them to be effective. So these are different samples that I thought I should bring in. Again, this is the upper zone. This is something that that Bill and I were talking. Bill was introducing some sort of a robot system. There's a building that he controls, and I'm doing the engineering. You would have this exactly like the robot that goes out and sweeps the stuff. He can literally go around and sweep overnight and destroy the germicide and be done with. And this right here, Sterile Air, that's the one that I am familiar with, but there are other companies. US Air Conditioning, actually, I went to a seminar like 20 odd years ago, and that's the one that is within the air conditioning system that you put it in and it kills. At that time, they were not so much looking at the germs, airborne germs. They were actually looking at the algae that grow within this bed. And the irony is that this light, I have seen inside of these things, they actually burn, it's become so clean that the light actually deflects, goes multiple into the other chambers as well. Of course, through the metals, this side is just the dry filters. This is another issue. I am an actually building engineer. I have 3 high rises in LA and 1 in Thousand Oaks. It's not a high rise. That one is a 2-story building. I've done maybe 800,000 square feet up to 970,000. I am actually going to be looking at, we have actually looked at a bunch of different subjects, but we do have these portholes. These are actually goes through the shaft that goes, again, I'm going to be putting in this format. So there is a chase. There is a chase that goes up, and these are the point of entries. And by the way, all of these must have smoke fire dampers. In the old times, they were just fire dampers, just enough fire. I know that must be an SFT. What you do is that you simply create a corridor of lights. So as they are passing through, they all get killed. Or there is another factor that I will bring up, another suggestion that I have that we will discuss in a few minutes. But again, no one says that we cannot have them throughout the whole chamber. And again, every plate in this building, some of them are 12,000 square feet plates and some of them are 20,000 square feet. Again, no one says we cannot be doing those treatments in this particular fashion. Again, the floor is open and any suggestion is a good suggestion. This was an unfortunate, again, I am an owl or a vampire, or whichever you want to call it, is that I was doing an entire video series all night tonight, and I was going through all of these, and there was one newscast, and I could not find it. I was too sleepy to go back, and I did not record it, but there was a newscast, and what happened was that around in Michigan, University of Michigan actually went to the high-rises and took samples. Guess what? They were infected. The filters in the high-rises had COVID. So the issue is that true in high-rise A or B or C? I don't know. But if they found out in Michigan they have now, don't forget, anybody that works there as a management, all the building engineers that go there must go through a full PPE rule as if they're going to a surgery rule. Because if these are infected, they have to be taken care of in one format or the other, whether they're actually dirty because of dust, or they are going to go there and they are going to sterilize them and put them back in. whatever they do. This was pretty scary, and unfortunately, I was not able to find. But this was I got this slide from somewhere else, but I just could not find this video to bring it up for you. This is another. These are somewhat of a review, but some of the newest stuff that I have identified for this group is that outside air. Let's say we discussed the last time that I'm going to be bringing, again, don't forget, HVAC units that you buy today is only made for 50% for them to heat or cool your air to bring it in, unless in an economizer mode. What is an economizer? Economizer says if outside temperature is 75 degrees, turn off your compressor, open up your outside air and let the air come in. Okay, that's the economizer. The issue is that if I am now advocating, by the way, with a 50% HVAC rule, you can kiss LEED goodbye. You can kiss the California Green Code goodbye. Those are all out the door. The reason is that the amount of energy loss that you're going to have, you're not going to get your Energy Star. You may get a point for higher than normal, 30%, 30% extra air. We will get a point for it. I am also a LEED authority, and I have 2 buildings right now. We just submitted one right recently. But again, outside air, that's one issue. So if I'm going to bring 50% day in and day out, am I going to bring the California smog into my building? The answer is yes. Right now, majority of them don't have a lot of filters. They just open up, or they have a dumb filter. You got to put something in there. The other issues, now that you got it in there, you better distribute it effectively, which is the next slide. Now, these are in a situation that you are in more like north of Santa Barbara, north towards Frisco area, etc. That the weather is too cold and you're bringing all that air in, you got to condition it. This goes up to 100 ton of air conditioning. If you have to do it, you got to condition and bring it in. Might as well clean the filters and put all these elements in front of it so that before you bring it in. This is literally just a dedicated outside air. It's called DOAS, by the way, in ASHRAE world. So, by the way, I did talk about this restaurant in China. I'm going to go through some of the examples. I didn't know there was so much studies on this, to a point that CNN and other groups have done the animation of this. This is where 73 people were there, and only this 3 tables got it. And then for whatever reason, they called it a poor air conditioning system. No, the air came through here and left to there. And apparently 10 people got infected. We don't know how many people died. And this was another paper. And when I did the search, holy moly, there was all these different animations and different studies that have been done just on that restaurant. So let's go back. This is an ASHRAE study of that, and they were doing animation of that on their own. And again, just to let you know, that was a very popular study. This particular study is very interesting. It has different elements to it. This was a call center in Korea. And what was funny, let me give you some of the statistics. Apparently 2 of them are there. And I didn't know if they were the same, whether this was in China or the ones, but at least the China one, that these are the numbers, and I got another one in Korea. But the irony is as follows, that this was a bank of air conditioning. And again, my proposal is the following. Put as many air conditioning as you can, 1 per zone. And again, what I'm doing in one of the Orange County cities, I have literally like 30, I put a 44-ton system. I'm going to put at the end 88 ton. Each one of the 44 tons will be carrying about 64 zones. Just about everyone will have their own zones. Therefore, they cannot cross-contaminate. At that point, if you go to look up for Michio Kaku, he says, what happens in 10 years? Hey, we'll have the phone system somewhere in our glasses, etc. Mike, what do you want? You will not go see Mike. You will see him through your eyeglass, the new eyeglass that you will have. Or maybe inside your contact lens, they will all be there. So what is happening is that all these individuals picked it up, not this 5. This 5 actually goes through possibly through the restrooms or the other contacts that they have, which I have, because of this, I have some slides created for that. So this particular one, I do not have the death rate, et cetera, but they are assuming these others, this could be air conditioning system, possibly contacts, so whatsoever, that they had personally, but these 5, they're simply saying it was different means and methods and substances. Another Korean call center was 1,145 people, 44% of the employees got tested, and 94% were all on the same 5% on the same floor. So I really believe the numbers simply say that these are the same group. The same for however the reporting was. The only one good part about was this: the air conditioning of this building, this floor did not mingle with the other floors. And guess what? Not a single person from the other floors were affected, and they were not infected. So let's move on. Dilution of outside air. Let me give you this. Again, this was a European paper somewhere in 1993. Again, what happens is if the dilution rate, you give more. Now, let me go back to you guys, or the architect, is CBC, that simply says 15 CFM per person, and goes to the California Energy Code, says 15 CFM per person. There was a time that we were smoking was allowed inside the building. We changed it to 20 CFM person. Then once the smokers were kicked out of the building within 25 or 50 feet from the door, it went back to 15. Now, what is happening is this: if we simply go from 1.3 to 5.2 liters per second, so we simply multiply that by 3, we have taken the percentage of infection of one person to the other from 35% to 5%. Again, remember, the last time we talked about probability analysis. When you're in nuclear, you're always looking at probability. Are we going to save everybody? I don't know. If there is 1 million people, there will be 1 or 2 or 3 that will get still infected. The question is, we are simply making the probability of getting infected less and less and less. So we are combining all of these in a utopia world that you guys are going to design and we will engineer. We will have all of these, and I am not going to fight over a air conditioning location for you guys, because you're going to give it to me and you're going to make the buildings taller and wider, whatever you're going to do, because I will be worried about the infection rate as well as the owners. By the way, if you all remember, in 1994, I was getting my CFPE in fire protection engineering at UCI, and they were just simply going from what is called the 6 air changes per hour to what was called smoke control. And atrium was one of the biggest elements. Guess what? During an atrium, all of this building is 1 atmosphere. Remember, we talked about last time that we are looking at NFPA 101 as our savior to understand how to compartmentalize different parts, right? Now, when you have an atrium like this entire building becomes atrium. The irony was, I did a project in Washington. I forgot which Benetton or one of the stores, and it was an atrium. And it was like 1998 or so. I simply said, oh, let me see, how did they do the smoke control? Guess what? When you go to smoke control, they said, oh, we revert back to the 1994 code, and they never applied that. And so I had my jaw on the floor. Somebody did something. There was another story, and if you recall Sam's theory about surface roughness, etc. You remember, if you have a carpet versus a hard floor, you're going to collect more than 20 times more particulates being collected on your carpet. Again, going back to the main concept that we had the 1950 paper that simply said that you have to have all these rough surfaces so that somebody does not have their mute on. Testing 1 2 3. Thank you, somebody. Anyway,
That was me, Sam. I'll keep checking.
no problem. Thank you, sir. Anyway, that would be the dusting control. Again, dust is a carrier. COVID is these are all particulates. And we talked about the last time that the way that we actually don't have the virus coming out of our mouth is our moisture of our mouth that comes out. And we showed the composite of it. And we simply said that do not use the bandettas with 1 ply, and everybody says at least use this 3 ply. And if you can find N95, use N95. But regardless, the most critical part is that the carpet actually will pick up 20 more times. Therefore, that becomes your source of intake. And again, my DNA was in stone because my father was in stone. And again, you want to have the joints to be as minimum as possible. And I did my home, and it's somebody called it a mausoleum. But anyway, I got so much marble there. But anyway, let's go back to the Psalms theory. If you have this, you have to have this as a part maintenance. And nobody knows that if these are contaminated from somebody. And don't forget, by the time a person gets infected, it'll take 3 days before it actually appears on the person. So all of these could be from an asymptomatic and or a person that will have to go to hospital. In either case, taking care of the floors is an issue. Here are the actual percentages. I can do this for you, and simply says the percentage of samples contaminated from bed railings, locker handles, cardiac tables, electric switches, et cetera, et cetera. And these are quite extensively done in the hospital environment. I have a little micro quiz, and you will answer it for yourself. What is the number one contaminant that is carrier between one room to the other? If anybody could raise their hand and just think about it, I will give you 1, 2, 3. And if you said the mobile phone of the Mr. Doctor and the physician, you would be, that would be the correct answer. And if it was my class, I would have to buy you pizza, because that was my statement. Anybody's phone that is comes on, will buy the pizza. But anyway, again, we go back to the Psalms theory of, and I guess I never knew I was going to use my master's and PhD thesis in this discussion. Filtration. We talked about, in fact, in one of the buildings in LA that we discussed, and I forgot to bring water for myself for the table, is that we actually we priced MERV 16, which is available in the market. The price is extremely high. Now, MERV 13 is the code, you have to have it, so on and so forth. So we'll stay with that. The issue is that you have to have the UV, the carpeting, and all the other items that we talked about, and we have to go with a bipolar ionization that is next. But ironically, look at this. The 0.12 where the Mr. Micron is, Mr. Coronavirus is right around this region, and that's the efficacy is lowest, unfortunately. So I'm going to leave it at that. So 13 is there, but I'll tell you what the bipolar does, what BPI does. So filtration is very, very critical, but these are the number of studies that has been done that simply, if you spend more money on your filters, your expenditure on influenza risk reduction, or your reduction in time value of the money of your employees will be far, far cheaper than going. Now, HEPA filter is very, very good. However, what the problem is that as you go with more pleats of the paper, the problem is that the static pressure of the system goes out to the moon. For now, we are going to go with MERV 13, and let's stay with it. Okay. And again, this is another study in London, where if you go with the MERV 13 with regard to cost, the filter cost is here, the mortality rate benefits and all that, or morbidity rates are here. So it is a good thing to do. By the way, we are MERV 13 anyway. God bless the state of California and the gringos who've done it. The gringos who, by the way, the people who wrote the green code, they were all gringos. Let's go back to work. Are we going back to work? Well, let's do this. Let's build the entire hospital in an IKEA style in 2 weeks. And that's what happened here. And my suggestion is that right now I was looking at hospitals that they would build, and field hospitals right now in Nevada, in the parking lots of the hospitals. Some of them are in the streets. In this case, you had it in the gymnasium in Madison Square Garden, et cetera, et cetera. This would be a factory setting if you have all the ABCs of the world, and these guys can actually work with the gloves, et cetera. This could be tomorrow in California or somewhere else. The problem is back to work indoors. That's the question. The other study that was done is that if you take 7,224 people, the percentage of the individual, the ratio of you would get infected versus if you work outside, it would be 2 to 7,322. So if you want to do that, you're looking at outside, and can we have an architectural firm out in the open? That's a different question. Or you would have is somebody's home designed this way. I do a lot of these homes. I can tell you that I am getting old. If I am getting old, all of these, especially if you're in the ocean, all of these would have to be oiled almost every 2-3 days, besides getting little ants, etc., going in and creating a little nest. And at the same time, if this is high friction, I would not be able to open it. My hand is now 124 years old, it's 62 times 2. It would be very difficult. By the way, the U value of these are only 0.4. Now, guess what? You got cross connections. And I do know if you're using some of the Chinese philosophies, et cetera, in building homes, you have to have an open corridors, et cetera, et cetera. But the question is, can you build this in anywhere USA, anytime USA? I don't know. Canon Design has these elements for, let's assume these are stations that you are greeting someone, you're checking somebody's temperature, et cetera. They have these. I believe this is just some model that they wanted to show off. That I don't know if you all remember when this green code started, everybody was sustainability. I mean, there was an accounting firm. The accounting firm had a green little leaf on the cards, etc. I don't know what that meant. I could not understand what that meant, but everybody's trying to do something. I know they're trying. I guess you can be in Rome, have your lunch outside and you're still outside, or you could be in New York City or in Los Angeles. Now in Los Angeles, these are banned. And New York City, the irony was somebody literally took studs and drywalls, etc. They built another space outside and they called it outside. I could not comprehend. I'm just too dumb. In any case, I guess you are now in somewhere in Italy again. Where is this? Imaggio in Rome. You can have this and you could have your dine. Or you have these little mobility. I don't know where this is, but you could have this and have fun within your own cocoon. But in any case, I've seen different formats of this. But again, you cannot greet and shake hands and thank you individuals. You can't do this anymore. I'm going to take you to a modern century car hops. This is an online order that you go in and you pick up. I was a car hop when I was 13 and 14, Oklahoma City. I was working for West Oaks Restaurant, which looks like Sonic's. And by the way, I could not find, I do have some photos. I'll put down, I was a hippie. I had hair up to here and all that. By the way, I had hair. That was the good part. And anyway, I was a car hop. And because I had my own dance, I made more money than my brother doing roofing and shingles. I guess this is our new, we can take our dates like we did in 1972 and go there. We are talking about restrooms. Could we have this? The answer is no. There's no way. And I simply took some photos, I guess, every so often. By the way, is that from there to there 6 feet? No. Would that separation, this right here, would we have to modify this? And that would be my proposal. I'm actually talking to, I don't know what I did. Sorry, I punched one too many. what happens is I am talking to Zern, and we are talking about these issues. By the way, I am a fellow in the plumbing industry. I've done a lot of too many papers there. So all of these will give you the 6 feet and also enough distance so that that will constitute 6 feet. And could we have this? Might as well. Let's add them on. The issue is those bathrooms are there. There goes ADA. There goes all the fabulous table in the California Building Code. And I believe it was table 4.1 of the plumbing code that we were supposed to have all those wonderful elements. However, this was the other issue. By the way, if you recall, if you had that what was it called? Single was unisex, if you recall. They were going to mingle all the sexes all into one. So you had, and my daughters were going to school in LA, and one restroom was converted there. It was wow. I just went to the other floors. This is the format. If you go to Costco, to gas stations, you know which aisle is open and not open. These are all the indicators, so you will have them. Because to me, restrooms are one of the most congested components that you have to go and you have no control because you have to have it, etc. So you may have to have all of these. Every one of these systems will be all touchless, as well as all the components. By the way, all the faucets, etc., during the Ebola became touchless, by the way. That was the time that it just went to the Zoom, it went up. And I pray you guys don't use the battery operated ones because there will be other issues. So but anyway, that's the bathroom, the restroom issue. However, remember the following, the exhaust rate, you have to upsize it. Today, one of my clients was like, what are you doing? You're putting 14 air changes, et cetera, et cetera. I said, sir, what do you want? As long as you have it to me in writing, I'll follow the code the verbatim. So he did not want that many air changes, and he called it hurricane. I call it Jacobian Myers. But what is happening is as follows, that high rate of exhaust is about 10 air changes. Now you can't have just simply an exhaust duct here and let everything go. You want to have what's called a laminar. What is laminar? Layers. You want to go in layers. And by the way, when you do a hospital bed, there are in layers, right? You want to have the doors to be all no touch. And then at the same time, occupants indicators, like I said, in the Costco gas stations, indoor touchless, et cetera, et cetera. And I liked this concept. And then I had a conversation with Niall this morning about the antimicrobial finishes. One day I will give the floor to him. Maybe at the end, I will let him chat over this issue. I actually worked with a guy who was an inventor of the Venetian mud about 10 years ago. In fact, if I take this background out, is a Venetian mud, is a green room. This is a full-blown green room. And he made some models for me. And we were looking at germicidal aluminum oxide to be added to the system, or copper added to his product. It will have a little bit of a jazz, but at the same time, it would have quote unquote antimicrobial. Why did I bring up copper? Because copper has the life expectancy of a COVID on a copper is only 4 hours. Paper is 24, copper is 24, steel and plastic is 48. And that's why when you go to plant check, they will not touch your plants for 24 hours. And that's why you lose 48 hours doing this. Anyway, extremely high finishes in China. And China, I don't mean the country of China. I mean the material of China. Toto came out when the Ebola was there. They came out with the finishes that they simply says our China has the finishes is so fine that these microbial that the hills and valleys are technically. The hills and valleys technically are gone, and is so that especially there are cases that inside the hospital that you have to have full isolations. So that's what I meant. China, not mainland China. Sorry, not Taiwan either. So okay, this is actually all that, which is 59 pages, about 54 pages that I added for the past 2 days, gives me about 20, 40 minutes left for the rest. I really, really, really want a discussion from you. I really want to get your questions. I want to incorporate them into the paper, into the write-up. Again, we are in a no man's land. This is very, very new. All the groups who have been speaking in ASHRAE are at the high level, academic level, bringing them down to what we call a practical level. It takes another multiple years. Bringing it out to the code level. I am actually, 2 papers I have published. It should be coming out is on plumbing. You should be coming out very shortly. It's for national level. And in those, I am talking to them, but that will be on the plumbing and the mechanical level for code issues. But again, at the end of the day, the only reason you will put a traffic light on a crossing is when people die or somebody sues or the guy has a lot of money. And if you recall, there was this Senator Stevens who built a bridge all the way in Alaska. It didn't go anywhere. Remember the bridge to nowhere? Or you just have so much power, they will build a bridge for you. But the issue is right now, the only thing that we have is CDC, and CDC is a guideline. So right now, the case that is coming out, the money that's assistance that's coming out of one of the reasons it's not coming out of the Congress is that they want to give relief to the corporations so they will not be sued. So that's one of the items. There are multiple other issues. That's one of the legal issues. But this is part 2. I put down the entire CDC guidelines for community work and school. And I also put the BOMA issues. I have only parts of this. And again, someone like William Calvert would have other on the medical side risk assessment issues. And then if you are on the management issue, you would be having some management, or if you're on the janitorial, it has different parts. I'm only going to be speaking inside at this point, mostly work for now, because schools will be shut for a long, long time for many, many reasons. I've actually highlighted, for example, the cleaning and disinfectants. That's the managerial issues and goes on, and the type of materials you use. And I'm going to go forward into my cases that I've highlighted. And this is one of them. Remind employees and the clients. Let me tell you the following. You shouldn't have your client in the building. Stay away. If you want to meet him outside. Put some sort of a couch there. Give him a wine, give him a champagne, et cetera, et cetera. Don't invite him to the building, because God bless, he could be contaminated, infected by somebody else 2 days ago. But he comes in, you will carry the lawsuit for him. You have to watch out for that issue. This is another one. Take actions to maintain a healthy work environment for your employees and clients. When I go through crossing and I am getting deposed, I generally get this guy, generally a white guy, a white person, generally very, very tall, much taller than me. His voice is very, very like a theatrical. He talks as if I am supposed to go into a firing squad. This is the sentence that they will use on the individual if they're going to do. Take actions to maintain a healthy work environment to your employees and your clients. That is the way he will put it, and simply says that was on CDC. You should have done it, and you should have known, et cetera, et cetera, et cetera. Essential workers. That's one of the reasons that the meat packing manufacturers, they made them essential workers so that they will not be able to sue them or not come. They had to come to work, otherwise they could be fired, so on and so forth. And these are some of the hyperlink guidelines that you could once it is in my blog, you could pick it up, or you can pick it up from this video and just identify it yourself. But I will have it. Again, I put this BOMA because, again, the high rises in LA and most of them are using this as a guidelines. I used the May 21st, that was the most updated one. Again, there's only a few items that I'm going to have. Again, this is a discussion that I've had with Bill, and I will beg him to speak at the end of this discussion. Owner's risk manager. And in fact, Bill's position has been for life, and And that's what he's doing in the buildings, 3 buildings that he has here. And risk manager. At the end of the day, I don't know how many people, maybe his architectural firm of 10, 5, 3, I don't know. There is a owner's risk manager who follows every one of these, goes to every seminars, et cetera, et cetera. Consult with legal counsel. Hello, you got to meet me, your Jacobian Myers, whoever that is. I have put these in italic. Those are my comments. I know a guy who I got involved with Legionnaire disease because I was a president of a society and I was inviting speakers. So we brought somebody from New York, and also there was many cases in Vegas. By the way, people died. Okay, now one of the individuals who was doing was a consultant, was a very good friend of mine, and we were having dinner. I forgot in Utah, one of these symposiums. He gave me the case. At the end of the day, let me just give you one item. Whoever is the manager, I can tell you in that particular code case, they went after his background. What did he have? What he, we're not talking about the janitorial service. We're not talking about the guy who was supposed to clean the water containment, etc. That was a button that they were pushing. They went back to the history of that manager, of that hotel to the nth degree. Just an FYI. And I'm going to go forward. This is still on the BOMA guidelines. And I'm going to go forward. You can see they have everything, signage, etc. I was talking to the ARC Solutions. They're making more money on making signs than printing out drawings because we don't have much drawings anyway. Building personnel must be continuously trained in this arena. If not weekly, if not daily, maybe a little 5-minute pep rally for them, just an FYI. Vendors and contractors do not come in if you have all the ABCs in the world and you've been trained the same way as the asbestos guys come in. Janitorial, the same way. Again, I'm going to emphasize, I do court cases, and most of the time I am creating hundreds and hundreds of questions to the attorney that I work for. And most recently, I work for Hyatt Hotel. One of the questions that I will ask are the janitors have been trained, so on and so forth, because of the carpet. And I show you that slide and I just shut up. I sit back and let them talk for about 5 hours trying to dig themselves out of that statement. The most critical part is you have to do your due diligence. It's very, very prudent avoidance and due diligence. Again, one of the discussions that I've had with my colleagues in these high rises is the following. Remember, all of these filters that are out there, they're all tainted. Assume they're tainted, treat them as a tainted product, and do they take them out repeatedly? Because if there is somebody gets there and we send out the point and they take a sample and that they think is tainted, God bless America. You do not want to be that position. By the way, this is my comment. These are italics are my comment. Yellow are my just for the sake of this discussion. Again, all of these, you want to have all these due diligence. And by the way, this right here, ICC 2018, there's nothing there. Okay, I actually have been teaching this, and not the ICC one is not ICC for California, it's California Plumbing Code, which California uses Uniform Plumbing Code. So you got to scratch that on modify if you're using this. But there are all these other issues. Filter banks are contaminated now. Please watch out. As they say, cuidado. Okay, elevators, emergency preparedness. I believe that for the risk management. And again, the other issues, we know only what we know now. Okay, again, one of the reasons 6% death rate that we had in the beginning, which was about 6.5% during my June talk, right now is down more like 2.3 to 3%, is because they found out, the Europeans found out, when the patient is in bed, keep rolling them, because what happens is when they roll them, the water, the pneumonia that is embedded into the body. By the way, the ventilators don't work anymore. If you're in the ventilators, probability that you are goodbye, you're done. But most of the time, that is one of the reasons they found out. And by the way, in terms of these cocktails, et cetera, these medicines that they do on emergency, not many people get them. The cocktail that was given to President Trump, only he was the 10th person in the world that got that cocktail. And I know Rudy Giuliani had that. There are not many people. So the beauty is that they have found out the other issues that the nurses, the COVID patient needs a lot of care, almost like one-to-one basis. They continuously have to turn this patient around in order to keep them alive. Anyway, this is a legalities. Please do all the due diligence to the tenants, to the communications. And if you are the architect and you're talking to your clients, you want to give them risk assessment risk. And this is where it becomes very, very interesting. It's telling you, do you have a risk manager? Who is it? Talk to them, meet with them, talk to your insurance broker, go through all the hoopla, because you are going to be, there are more attorneys in this country than the entire Europe combined. And if you speak 50 languages, they will say, have you fallen in 50 languages? And they want to chase you. And then again, more legalities on your leasing and contracts, etc. This would be true for the architects and their contracts. Please do that. These are additional resources that is out there. By the way, everybody has resources. This is the AIA website. There's nothing here, my friends. Nothing. It's all watch out. You could just put down the CDC guideline and call it a day. I believe we should take the contract documents that we have, all the AIA contracts, we should at least put some sort of a modification, or maybe AIA Orange County. And I know in AIA Orange County, there are a bunch of guys from AIA California. They should put something together and be there. I picked up all the National Law Review. There's 800 cases out there, which mostly have to deal with, some of them are employee relations, et cetera, et cetera. I went to National Review. There was nothing out there that is very, 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 what they call succinct, that simply takes you there. And there is no easy task. They are simply walking on a very, very thin line. It's like grasshopper walking on rice, if you all remember Kung Fu. The grasshopper had to walk on rice and nobody was able to hear them. And building ventilation is there. God bless America. You see there? It's right on the National Review. They're eyeing on that as an issue. And here says, employers have affirmative obligation to discuss ventilation system improvement with the building management. That is a lot of ifs. Screening, et cetera, that will be for the building management. And that's the end of that. And then, by the way, if you simply call COVID cases, guess what? All the lawyers come out because they take the word case and COVID, and everybody has written. So they just don't want to be left alone in the body of the humankind. Anyway, these are different cases. By the way, I found out if you simply put down this word, you will actually get much more links as opposed to cases, COVID outbreaks. I have a number of these. As an engineer, or you all as a architect, would not be looking at these numbers. What I would be looking at this, how is this set up? Who went where? Could I rearrange that particular choir? Could I modify them? Could I modify the building so that the choir, now if, let's say for the sake of argument, choir gets infected, what about the priest? What about the other? What about the kindergarten? Was it designed in such a way that we could reduce that? So in this particular case, there were 53 cases and 2 deaths that occurred. And there were 120 chairs. It took off for 40 minutes. And these guys who do tracing, they do it's like a dragnet. They're writing. He went there, then he sat there for 5 minutes. He woke up and had a tea and then went there. Right? They write the entire spiel. So this was the case that I actually brought in. I said, I will talk about. This was the same case that one individual, all of these individuals got it, but not these. Was it because these were young, or was it because the air conditioning system, or they were doing hugging and touching, thank you and kissing and all that? I don't know. That would be my response, my request if I was doing it. But the other issue that I would simply say that the index patient was there, prior practice occurred, and look at the confirmed or probable confirmed are this, how well it's spread out. By the way, you're talking about 5 million traveling in Thanksgiving, 22 more days, and that's the 22 more days after that you get the cases synchronized. I'm getting to a point that I'm going to go a little faster because I want to stop at 550 or 545. Family was then 16 confirmed, 3 death. By the way, all of these are here. They came from numerous sources, but this was the issue, how they met and how they got contacted. And they generally, depending on these deaths, are depending on the morbidity of the individual, how old they were, et cetera, et cetera. And those who were alive, primarily, they were a younger age. By the way, we have 500,000 as of a date somewhere around less than age of 18 that have COVID. So please don't say they are totally immune. In 3 days, in this particular case, there was a church chain that occurred. I have another one. This was a different one. 35 subsequent cases was directly related to this particular case, and symptoms began and dragged on. I have 92 attendees and 38% confirmed, etc. Again, we are looking at it as an architect. We are looking at this particular person goes out. This may not be a very good example because these are basically homes. It would be very, very difficult, but just Ben went to a religious service. At the end of the day, 9 people got infected through this chain. And at the same time, this was another one, it was a home intact. Mary was in contact with her boyfriend, and bang, you get 5 people infected. Again, homes are very difficult. But this was a very famous case. I forgot how many thousands were in South Dakota. It's the state of Minnesota. For those who did go back to Minnesota, state of Minnesota carried on 51 cases in Minnesota. Residents who attended, 3 was hospitalized and 1 died. From this 51, 35 subsets of individuals were received it, and only 1 was hospitalized. That was a motorcycle issue that they were there for about 10 days or so. This was another case of a hospital, a prayer where 2 people died out of 68. And again, as an architect, engineer, we would like to find out what transpired. Now, this is a full-blown paper and the outbreak in an Amish community. And this was very, very long, very, very long. And that would be great to come back and create an architectural engineering scenario out of it. I got 8 minutes to go. And this was about 30% persons in a laboratory setting was confirmed out of that parishioners that in the church service. This is a long, I left it. By the way, there's something, one of my second daughter actually, who's in medical school, she got her MPH out of Columbia, and she was always dealing with the R value. What is an R value? What happens is in day zero, he infects 2 people, it multiplies by 2, it multiplies by 2, it multiplies by 4. What is happening is that if there was a movie Dustin Hoffman played was Contagious, I believe that was the name, the R values continuously talked about. You want to have the R value less than 2, so it stops here. So this will not have a domino effect and get this many. Anyway, I just had to put that in. And there was another one, which I will not have a discussion, that's just for you to know. This was the Guangzhou, we talked about this, China item, but at the same time, Guangzhou was the one that had the restaurant. But there was another article, again, I'm looking at the plumbing side. Apparently, there was in an article through the toilet through the piping system that they were afflicted, and in that apartment. Again, in the United States at least, trap primers are there. By the way, why did trap primers occur? In about 1850s in Great Britain, they did not have trap primers. And what happens, this smell from one place to another, rats were coming inside the building and ants were crawling, right? So in any case, I don't know about this, but I do know that that is an issue that it was very interesting for me to bring up. And let me go on. There was a poorly ventilated system. This is the Guangzhou, again, the same restaurant. Again, I don't want to call it, this was a poorly ventilated bus. We're not talking about buses. This was poorly ventilated conference center. The only reason, again, let's go back. In the United States, both codes, UPC, UMC, and IMC, which is California Mechanical Code, whatever, regardless of where you go in the country, 15 CFM per person, and you always design with 6 air changes. This guy was doing it 15 minutes for 4 hours. This was a very, very bad. Remember, we talked about going from 1.3 liters per second to 5.3, you reduce the infection rate. And this was I don't want to talk about a cruise ship. Oregon hospitals, all of these cases, I'm just going to go on now. All of these cases that I brought in, it simply said how they treated, how long they were there, and how did they deal with it, and how did they do the sampling. It doesn't have a lot of numbers, etc. But again, as a researcher, you really want to know. I just went to DC, brought my wife back. After 11 months, she was out there. And anyway, there was this issue. I am very, very interested to find out. I had a major discussion with Bill Calvert on this, how to get inside. Again, HVAC operation in ventilation, we have killed this horse to death. But that was an air distribution, filtration, air disinfection, wastewater, mechanical hygiene, all of those we discussed. And then let me just simply say that at the end of the day, I do have one, let me see. This one. I had to say this. I'm going to spend a little time. Construction site outbreaks. Guess what? In April, May, Denver, Maine, in Bryant Denny Stadium, Allegheny Giant Stadium, Nashville, the University of North Carolina. These are job sites, and you assume that they are outside, or they could be inside. They're walking as if nobody's doing and whatever. I just wanted to bring this up to you, and maybe if you are putting your construction documentation, you will have that in your documentation of the best management practices for your construction team, because still you're the architect and they follow yours. But there is a contractual documentation again. Let's say I had to bring this in. There's one more. This was very interesting. By the way, many states, i.e., for example, Florida, stopped populating data of their COVID patients inside. But I found this from inside of this in Michigan, and they publish this, by the way, monthly. And this is great for our discussion. All the number of patients that they have in types of building. I don't care about the agricultural camp, but I do care about a bar employees, restaurant. They have this detailed to a very, very nice retail, personal services, nail salon, jail, healthcare. The number of patients every month in the state of Michigan. And guess what? They have it broken down to 8 regions. That was fabulous. I really like that, because it simply tells you and me that if I have a long-term care facility, and I do know that there are several of you that do this type of product, you now have to rethink all your philosophy, because 77 people in month of December, as of December 3rd, in that month in Michigan died of COVID. So if you're talking about a bar, in that particular case, 3 persons died. By the way, you and I don't need 5 lawsuits to lose our licenses and or our insurance. Just one. Uno. That's it. Beer. Whatever, however you want to say the word. One lawsuit will kill our companies. You just want to look at religious services, 2. And by the way, social gatherings, birthday parties, etc. I don't know if they were inside or outside. 253 died in that particular this. Again, we are now we are taking the burden of the society. Again, please, there are 800 cases as of last time I looked. Let's not become case number 801 in the country. and I have a begging request. And this was a sample. Maybe I will reduce this so you can see this. This would be my request. Wear a mask and stay alive. Let's take questions now. Now I got to go back and find out how to find the last time I had to do a little struggle. And okay, full screen. So if anybody has a question, please unmute yourself, and then I'm going to go till I find my my chat room.
Tom,
Yes,
can you
sir.
hear me? This is Bob with Indicon.
Yes, sir.
Okay, we started talking about this earlier a little bit, but I want to focus on something. I don't know how many people in the audience listened to Marcus and Millichap's talk, a webinar yesterday about offices in the major cities. Just briefly, New York, Chicago, San Francisco. They are the least amount of people. We're talking about in the teens, from 12 to 17% in the major cities of people who are returning to the office. By comparison, Orange County was reported as 60% of people are returning to offices in Orange County. And the explanation given by Marcus and Millichap is that when you have public transportation, and this again applies to LA, there are less people returning to the office in LA, particularly in downtown Los Angeles. Each of these has in common public transit of a lot of people coming and going and everything. So the question is, with the vaccine coming out here, we understand in time, and it may be mid-year 21, before people will feel comfortable returning to an office. I'm just wondering, so far as architects are concerned, we're contractors, but we take our lead from architects. I wonder what architects can do now to buildings where, let's say, like the Irvine Company right now is going through and changing the filter systems and making all kinds of changes within the buildings. I just wonder what the architects need to do now in those buildings that may need to be renovated in some ways in order to make everybody feel comfortable there. And looking forward, I think the fear factor is definitely there for people going to office buildings. What responsibility or what can architects do besides some of the things that you mentioned here? What are some other things that you might suggest in terms of a hit list of what architects should do to make these buildings safer, where people can feel more comfortable returning to the office?
I'm going to do an open mic. If anybody wants to respond, that'd be great. Go ahead and fill in. But I do want to have a chat with Bill, only from his perspective. I have enjoyed working with him. But go ahead if anybody has a response to that question.
I've got one. This is Tad Lupton. You know, one of the biggest things is going to absolutely be changing human nature, because, you know, restaurants moved out into the streets, and the reality is the restaurants themselves and people pushed the tables as close as they could to maximize the dollars they can get out of it. So yeah, we brought everybody outside, but they're sitting back to back in Huntington Beach. So, you know, it doesn't do any good unless people actually take this stuff seriously and change how they're interacting with each other and with the spaces they're expected to go into.
Yeah, let me just add one item for you. In my fire protection life, one of the issues is a fire egress is the human behavior, or their age and their format, or the employees, et cetera, et cetera. And at the same time, when you are doing a traffic study, is the humans, the type, the nature, et cetera, et cetera. Human factor is always there. I totally agree with you. And one of the other issues that right now I want to apologize. I have been in science for God knows how long. I started college when I was 13 and a half. All I can tell you is science is the only thing. And I don't know why you have problems with masks. So if you have 30% of the people not doing vaccination and X number of people are burning their mask, you're absolutely correct. So I don't want to get into a behavioral science here. You want to stay with the concept, but it's a good question. But I do agree with you, is a human behavior issue more than anything else.
You know, masks are great when you're doing sort of I mean, again, when you're going to a place or whatever, but there are plenty of activities that you do where the mask doesn't work, or isn't enforced. I mean, I've got a son in college who runs cross country. They're not wearing masks when they run. And sure enough, the last day on college campus this semester, they all got together and about 80% of them got it.
Well, let me table the mask issue. Let me go back if there is any question, because I'm having my computer is acting up. I don't want to touch it because I will lose everybody. Is there any other oral question on the chat room that somebody wants to bring up right now? I want to give a couple of minutes to Bill because he has a different perspective than I do. And so, but go ahead with another question before I bring Bill on board. Anybody? If not, let me ask Bill Calvert. Again, Bill has worked as risk management, etc., and we both consulted for a very short period for a car manufacturing just recently. Bill, if you're online, could you expand on the discussion that you and I had, especially on NIH, some of the discussions that I had. At the same time, some of the risk issues that, especially you brought up a comment last time, that you do not want to add something and then at the same time create another risk somewhere else. Did I understand your comment last time?
Yeah, it's basically just a safety engineering issue. Is your mitigation, you never want to create additional hazards. I mean, it's kind of like a do no harm clause. So if you're going to change, the atmospheric or the protections or the different chemicals, or you're going to do something that alters the system that you're in, you're also changing the hazards, and you need to evaluate that at a systemic level as well to make sure that you have a net benefit for your work. A couple of comments of things that we covered today. You mentioned that you could get LEDs, for example, in just about any frequency that you want to specify. That's honestly not really accurate at this point. You can order a bunch that can emit in a range, but a lot of times it requires a filter. But the doping materials is what really drives that. And in that manufacturing process, you're adding different chemicals. So you're creating additional hazards there. And the power outputs aren't really at the point where you could necessarily kill the targeted viron that you're going for, or the class of biologicals that you're going for. So even though we're working on solutions for the thing that's, the big glaring monster in the room, we can't, ignore the fact that we have a lot of other hazards involved, not just in the manufacturing of the solution that we're engineering into the product, but in the occupational exposure of the people as well. Your 254 nanometer solution might be great, but that definitely creates an ocular hazard and a skin hazard to people who are exposed to that far UVC. So industrial hygienists, that's kind of their specialty with that. Safety engineers get involved in some of this. And there's honestly a 70-year-old branch of biological weapons engineering that's considered a lot of these issues. And you'll find a lot of that in the technical data services as well as CD.
I lost you, Bill. You mute yourself, Bill. Oops. Sorry. Is anybody?
That's all right. It was unmuted, but
okay.
I guess I hit the wrong button.
That's right. There was one, by the way, I just want to let everybody know, I invited Bill. Bill is actually out in Houston, just to let you know. So a special thanks for him. I do have a friend and a client out of Kansas City and is here too. Thank you, Troy, for coming in.
Appreciate it. Thank you.
Anyway, Bill, if there's anything, I see Sepand in there. All I can tell you at the end of the day, within the few minutes that we have, by the way, I am so chicken, when you become a nuclear engineer, you get scared. Every time I touch this is trying to do something and I don't want to lose all of you. But I'm going to ask Jeff to go ahead and save the chat questions so I can have it and I will implement it into my write-up. And if anybody wants, as long as you don't look up on the bottle of a milk carton for my face, You can always email me and I will send you PDF of this. If I send it to you personally, I am safe. If I put it on my blog, I get into trouble right now. I got to clean it up for that purpose. And I want to appreciate Kelly for sending those the uplights. And Bahram made me, I had to go and comb my hair. I looked really awful. So once I saw he was dressed up, I had to do that. Is there any other comments that we could entertain?
I guess I kind of had one question.
Go ahead.
I'm just looking at, like, facilities and things like that. I work for a health fitness brand, and so my question would be is, obviously there's certain methods we can put in place with filtration system, things like that, to help the different building structures and so forth without passing that contamination through the systems. My question is, a lot of people, businesses, or even small businesses can't afford to do these upgrades and things like this within their facilities. What are other ways we can combat this to, prevent this spread and so forth during this time while, obviously COVID's present?
The only thing I can tell you is what I know from both codes as well as in front of the cases that I've done, is that technically cost has never been an issue unless you get an assistant from another organization that simply says, help me out to upgrade to do this. But I'll give you an example. When we had the first interstate fire in Los Angeles, the city came back and said, you have to go through a $4 or $5 million worth of fire protection. I'll give you X amount of time so that you can upgrade. But in this particular case, if he or she does not do ABCs, the individuals won't come there. And so if you have a 24-hour fitness or some conglomerate, Equinox, et cetera, does it, you will feel safer to go there. I'll give you one other example. I came back with Delta and I flew in with American. American, you are packed in the sardines. In Delta, the middle rows are not packed in. So I will fly definitely. So that would be a question. The only other item that I know that if the product and Kelly and those who are in the product business, they know if the quantity goes up, the price comes down. And I can tell you that the Halo LED was $250. It came down to 100. Right now, you can actually buy a Halo little can for about $6, and you could go to Costco and buy something else for $4, much cheaper. So all I can tell you, that would be the only one. However, though, let me give you this. The low-hanging fruit that I can tell you is that the bipolar ionization is cheap. The MERV 13, I know you and I work in the other states, but MERV 13 used to be a 4-inch, I don't know if I've lost my video or not, it used to be a 4-inch filter. Now it's 2-inch, it will fit anywhere and it's not that much cost. So I would simply say, at least you want to go with the low-hanging fruits and go from there, at least with that. Otherwise, the court, when the lawsuit happens, cost or code do not care.
All right.
Although there are examples like ADA requirements where originally it was everything was supposed to go to ADA right away. And then all of a sudden there were those exceptions of, well, unless it's cost prohibitive.
Yeah, you have that $150,000 and 20%. And I agree with you. And even right now, because there were so many frivolous lawsuits, they give you 6 months now to correct it because they had the ambulance chasers out there running after ADA. But however, this particular case that Troy is talking about is actually a civil suit, which goes from the individual who's going to his fitness centers, and when they come out, and they could have gotten the COVID from somewhere else, but they simply says it was your property that didn't do ABC. And I've been in cases that an army of engineers go in there and they scan, they say, oh, you did not have the A, you did not have the B and C. Therefore, you're going to, at least they want to grab some money for whatever reason, the Jacobian Myers and those guys do. But you're right with ADA. I was involved with that a little bit. Any other comment with respect to Troy's question? It's 5:59 officially. Anybody who was with us for an hour and a half, and those of you who want to get the credit, just make sure that Jeff and Marlene have your names, et cetera, so that you will get accounted. I will be putting this onto my blog. I am going to be speaking to the Orange County inspectors on, I believe it's February and March. But again, when I speak to them, has a different perspective than to an architect. For them, is more of a code and inspection issue as opposed to code creation or design issues. But I will have it there. But fortunately, if you join late, again, if you go to AIA Orange County, and if you just simply filter, if you simply put down AIA Orange County, if you go to YouTube, we are actually there, and you put in today, in terms of, if you go to the filter and put this week, you can actually download 1.5 hours of my scratchy noise there. And then very likely today or tomorrow, this will be up there as well. I generally don't put videos. I find out I'm too ugly, but I put down blogs you can always read. But I will have that and more. I will be continuously updating this because, again, things are changing and more and more. But again, I am praying, this was my prayer, that we can create emotion through this AIA, through all the, I don't know how many people are here now, 22, through all of us that are here, we can create emotion, create some sort of a movement to create some sort of a response. We just cannot hide under the table and simply say, these are guidelines, et cetera, et cetera. Again, I'm going to go use my lead attitude, which simply says, if there are low-hanging fruits out there, take it and use it. And again, at the end of the day, prudent avoidance will be my statement. Again, when I was doing those EMF world, I was doing, at least I did about 10 or 15 court cases. I don't remember, that was 20 years ago. We were only going that direction. We were redesigning the space so this high-rise would not get into a further lawsuit than he was there already. But otherwise, the most critical part is stay safe. It's bad out there. It's very bad. Anyway, God bless you all. If there's no question, we will end the session.